Young people in the country have been put on high alert, with the Ministry of Health warning that they too risk succumbing to the virus if care and precaution are thrown to the wind. Now, this comes after 2 young people, believed to be very young, died despite having no pre-existing conditions. However, of utmost concern continues to be the testing results discrepancies seen from private testing facilities in the country. Let's get more from our very own Raquel Mwigai.
For the last few weeks, Kenya has been reporting COVID-19 related deaths, a majority of which have been accompanied by explanations of pre-existing conditions and old age that could have possibly complicated the chances of survival. However, as the disease continues to spread, increasing the number of cases worldwide, new information on the virus continues to be discovered daily.
There are 2 people who didn't have any coexisting medical indication or condition. So that is usually a source of worry for us, because then it means either the infection is they are getting a more serious form of the infection, which therefore means that we need to be able to warn the young people that not everybody who gets COVID, you could be that unlucky person who gets a more serious form of COVID-19 and therefore succumb to it.
A situation that is not unique to Kenya, as just this week, this 24-year-old in Minnesota, United States, collapsed and died after only exhibiting a cough. Medical authorities ruled COVID-19 as the cause of death. She tested positive and had no pre-existing condition. According to her family, she might have contracted the disease after going out partying with friends. A scenario in which a majority of young people here in Kenya can relate to quite easily, given the many arrests made of those found flouting set measures.
So it is imperative that the young people take these precautions very, very seriously. Initially, in the early phase of the disease, remember most of the people who died had coexisting medical conditions.
It appears the challenge of flattening the COVID-19 infection curve does not only rest with adherence to set measures by the young people in the country, but also the availability of testing reagents. Only 4,621 people were tested within the last 24 hours, with 461 persons returning positive results across 19 counties. Nairobi leading with 248 cases, Machakos 97, Kiambu 20, Kajiado 15, Migori 14, Busia 12, Nakuru 11, Laikipia and Nyeri 7 cases each, Lamu 6, Uasin Gishu 4, Kakamega and Kisii counties recording 3 cases each, Kisumu and Makueni 2 cases each, while the counties of Mombasa, Taita Taveta and Bomet recording a case each.
But as countries move on again to reimpose restrictions, like what is happening in America, going forward there could potentially be challenges in terms of acquisition of these important commodities.
While the ministry is trying to ensure no backlog of testing is experienced, questions arise as to different test results seen from samples tested in private and government laboratories. St. Andrew's Turi in Nakuru has become the latest victim of such a mix-up after 17 of their teaching staff tested positive for COVID-19 at the Lancet laboratories, only for the said samples to turn negative when tested at Kemri 3 days later.
I think we need to do much more to ensure that the integrity of the results that we give, because they have a huge impact, both psychological, financial, and even social, becomes very, very accurate.
Those affected now want the ministry to be keen on the effectiveness of testing capabilities of private facilities to avoid false results that could hinder strides made in combating COVID-19 in the country. Raquel Mwigai, Citizen TV.